Many people, their job involves a lot of talking. For example, they could be school teachers, they could be lecturers, they could be doing telemarketing, they could be meeting with customers all day, it could be a therapist who is speaking to clients all day. And during speaking, our breathing volume increases, but it's not matched with an increase in metabolic activity. For example, it's okay when our breathing volume increases when we go for a fast walk, or we go for a jog, we go for a run, because there is an increase in metabolic need for oxygen. But during talking, breathing volume increases, but there's no corresponding increase in metabolic activity. The result is overbreathing. And many of these individuals, they may notice that they're very tired following a day's talking. They may notice that their talking brings on a cough, that it's drying the upper and the lower airways. They have increased amounts of mucus. They may be, for example, losing their voice. So a lot of these symptoms, even though they may not have put the connection to their breathing, a lot of these symptoms can be helped when breathing is under better control. And for example, this paper here, it found that all subjects ventilated more during speaking than during quiet breathing, usually by augmenting both tidal volume, which is the size of each breath, as well as increasing breathing frequency, which is taking more breaths per minute. These findings have clinical implications for the respiratory care practitioner and for the speech-language pathologist. In addition to this, singers, actors and public speakers are especially at risk. Stage fright, it's often a panic attack which may cause or be caused by hyperventilation, because invariably what hyperventilation is doing is causing a drop of carbon dioxide. The individual is breathing too much. A loss of carbon dioxide is causing the carotid arteries to the brain to constrict. So the amount of oxygen available to the brain can decrease by up to 50%. Now this also will activate the fight or flight response. So as many theatres in London's West End, they apparently had a brown paper bag behind the stage. So it was there as a useful resource if, for example, an actor or a singer got stage fright, they would take a couple of breaths in and out of the brown paper bag to help rebreathe carbon dioxide back into their body, into their lungs, to increase the CO2 levels in their blood. However, a much more efficacious way would be to teach these individuals to breathe properly in the first instance, to have light breathing during rest, and they can carry that light breathing into their singing and into their speech. And the benefits then is that you have a better voice projection. You've got a stronger voice, a clearer voice, and that's going to be something that's very, very useful with these groups of people. So the effect on breathing, yes, of course, it can affect sleep, it can affect respiratory, the gastrointestinal tract, and it will have some role to play as well in vocal dysfunction. So speech, it's the culmination of two essential human functions, breathing and communication. So we must consider all the factors in relation to one another, because a disturbance in one area will upset the balance necessary to maintain healthy phonation. And things to be looking out for, example, is there frequent throat clearing, excessive phlegm? Does the client or patient pause when they're speaking? Are the pauses appropriate to place in utterance and frequency? Does the vocal pitch appear appropriate for the patient's age and sex? Is the voice hoarse, creaky or breathy? Does the voice fade or appear to fatigue? Is there limited ability to sustain phonation or to hold a note? In other words, can the individual hold a sentence or conduct talking over a period of time without running out of breath? And the effect on dysphonia, excessive breathing volume, it dries out the vocal cords, and of course this is especially breathing through the mouth. It's going to dry out the vocal cords, resulting in excess phlegm. It also results in poor breathing pattern and breath management for speech and singing. And the effect on dysphagia, because over-breathing, it dries the upper airways, leading to inflammation. And it's also very important, there is a connection that when somebody presents with dysphagia, by having them do breathing exercises, you're helping them to be more mindful. And also, of course, then that can translate into when eating, that they can be slowing down and to be more mindful when eating. So now we're going to look at the effect of overbreathing on the autonomic nervous system and the link with speech and more specifically with stuttering. The autonomic nervous system is to maintain homeostasis, which is an optimal or ideal physiological and emotional balance, and in doing regulates and coordinates many bodily activities such as digestion, body temperature, blood pressure, and it's associated with aspects of emotional behaviour. There's two branches to it. The parasympathetic branch is thought to foster calm physiological states that promote growth, restoration and repair. And on the other hand, the sympathetic nervous system activity is associated with fight or flight or mobilization behaviours. So this is typically your stress response, and it's activated during periods of stress or challenge. So in this paper here, which investigated the autonomic nervous system activity of preschool-aged children who stutter, and it found that children who stutter have a physiological state characterized by a greater vulnerability to emotional reactivity. In other words, less parasympathetic tone. And they also had a greater mobilization of resources in support of emotional reactivity. In other words, more sympathetic activity during positive conditions. So they had reduced parasympathetic and had increased sympathetic. So in other words, reduced relaxation and an increased susceptibility to stress as indicated by sympathetic activity. Where breathing comes in is that controlled breathing, it helps to activate the parasympathetic nervous system. It promotes homeostasis and it assists recovery and restoration of functions in body systems disturbed by stress. I have used reduced breathing and gentle, the breathing exercise that we do with individuals who stutter, and we have seen results. And it's possibly due to activating the parasympathetic nervous system that when we slow down breathing, we're evoking the relaxation response. We're also, of course, improving the coordination of breathing with speech because the individual can hold a sentence for longer, that they're not running out of breath, And of course then, when you change breathing, you have to improve the amount of oxygen delivered to the brain. So regions of the brain that would normally become excited, with improved oxygenation there, it helps to calm them down. So regular practice of slow controlled breathing has also been shown to increase basal parasympathetic activity and reduce sympathetic activity.